Hi, I'm Michelle Grazoulis, and I'm president of the Foundations at Rochester Regional Health. Happy New Year. This is my first Facebook Live of 2020, and I am very happy to be joined today by Dr. Lou Eichel, who is the chair of urology at Rochester General Hospital. Hi.
Hi.
How are you?
Very good.
Nice
Pleasure.
to see you.
Thank you. Pleasure
Happy
to be
New
here.
Year. Nice to have you here. So today, not surprisingly, our topic is going to be men's health and talk a little bit about specifically your area of priority and care. So I want to start with really talking about men's health as a whole. How do you approach that, and how would you define that for our audience?
Well, I think the most important thing to understand about men's health is that men tend to go to the doctor a lot less often than women do. They just don't like to go. Men are supposed to be the macho caretakers, and they generally try to put off their own problems and try to take care of their own problems or family's problems, other people's problems. So it's hard to sometimes get men to go to the doctor. But generally for men's health, screening should start actually at puberty, where men should learn how to do testicular self-exam.
Really?
Because testis cancer is really one of the main cancers that affects young men. So I just wanted to mention that before
important.
we get on to other things.
Yeah.
But then other things like, most of the other things that affect men's health are things like injuries or maybe sexually transmitted diseases, which hopefully younger men are learning about in health class in school and things like that. But then really that takes you right up into your 40s and 50s.
Yeah.
So until then, really just testicular self-exam once a month in the shower.
And that starts in teenage years, puberty.
Right,
Puberty.
actually before teenage years.
Okay.
Yeah, like I would say at 10, 11 years old, somewhere around there.
It's like
for some
breast self-exam where you get used to the feeling and you know what's there and what's not there.
Right, so that you can detect a change, exactly.
Okay.
And then really that takes people really up until their 40s. If you have, then the next thing that comes along is possibly prostate cancer screening.
Yeah.
And for prostate cancer, if you have no family history and you're of non-African American descent, prostate cancer screening should start around age 50. But if you have a family history and a first-degree male relative, so father, brothers, uncles, your screening should start earlier, probably around age 45.
So I'm going to have you say that again, because I think sometimes when we talk through this, things get lost. So start again when a non-familial person or with cancer in their family should start.
So for screening for otherwise healthy men with no family history of prostate cancer and of non-African American, so Caucasian, any other background than African American should start at age 50.
Okay.
Because African Americans have a higher prevalence of prostate cancer, their screening should start more around age 45.
Okay.
And if you are of any background but have a family history of prostate cancer in a first-degree male relative, so father, brothers, uncles of your father, then screening should start at around age 45 as well.
Okay. So I'm curious about the relationship, if any, between bladder cancer, kidney cancer, and prostate cancer, because I know your recommendation would be those are the three things that men should be screening for.
Yeah, so so prostate cancer affects 1 in 6 men in the United States, so it's an extremely common disease, whereas bladder cancer and kidney cancer are less prevalent.
Okay.
We find that much less often. Generally, the screening that you would have for bladder and for kidney cancer would just be a simple screening urinalysis. You go to the doctor, they check your urine just to make sure there's no blood in the urine. Otherwise, that's really the main screening for that, and you should start having that done yearly, pretty much when you start going for yearly physicals, which again is usually around age 45 to 50 for men is what's recommended. In terms of prostate cancer, though, because that's so much more common, we recommend specific screening. Also, the screening for prostate cancer, which we didn't talk about yet, is to get a rectal exam once a year and also a simple blood test, a PSA test.
So let's talk about prostate cancer, because we could probably spend half an hour talking about all of that, but I know we want to make some specific comments today about that. So let's start at the basics. Define prostate cancer. I want to talk about what are the symptoms of it, how do people get screened for it, and what are things that a listener might say, hey, I should pay attention to that?
Okay, yeah. So the prostate cancer is basically abnormal cells that come from the prostate, or they originate in the prostate, but then they grow out of control and can grow into other parts of the body, like the bladder or into lymph nodes, and grow in places that they're not supposed to grow, in your bones, and then they start to cause trouble with other functions of your body. Prostate cancer does not really have any early warning signs, which is why it's important to screen for it. If there were early warning signs, that would be great, but there's no early indicator. And by the time you do diagnose prostate cancer because of symptoms, which might be something like blood in your urine or having pain in your bones or in other areas of your body, or having trouble urinating, by the time you have those symptoms, it's really too late to cure it. It can still be sort of palliated or, kept at bay usually, but there's really no way to cure it at that point. So that's why screening is so important.
Okay.
So the screening test, again, is getting just a simple prostate exam, a rectal exam once a year, and a PSA screening blood test.
And that for men happens in their primary care appointment?
Yeah,
Okay.
the U.S. Preventative Task Force recommends starting screening at age 55.
Okay.
The American Urological Association and the American Cancer Society recommend starting more at age 50, and again, for people with a family history or of African American descent, starting at age 45.
So normal screening, and then someone is told, hey, something doesn't feel right, or it's an elevated PSA level through the blood test, right?
Correct, yeah.
And then they come and see you, right?
Right.
So then walk us through what happens when they come to see you and what the treatment options are.
Right. So at that point, we have a discussion about the testing and the pros and cons of being actually checked to see if you have prostate cancer. And if we decide together that actually checking to see if you have prostate cancer is the right thing, then the next thing is to get a biopsy of your prostate,
Okay.
which is a simple procedure that we do in our office. It has a very, very low risk to it, but there is a small risk of getting a urinary tract infection from it,
Okay.
or having some bleeding, although that's rare. And most men tolerate this very well. If you are diagnosed with prostate cancer, then each patient really needs an individualized treatment plan. It really depends quite a bit on how old you are at the time of the diagnosis, what other medical problems you have, what your life priorities and goals are, and things like that. So it can vary quite a bit. The majority of men who are diagnosed with prostate cancer are diagnosed with a low-risk form of prostate cancer that
Okay.
can often just be monitored closely. But if you have a more aggressive form of prostate cancer, then generally that requires some sort of treatment, assuming that your life expectancy is 10 years or more.
Okay.
And so for patients who fit that description, there are multiple treatment options available. You can have your prostate surgically removed, which nowadays we do robotically. You can have various forms of radiation therapy. There's a form of treatment where we freeze the prostate called cryotherapy. And then the newest form of therapy that we've been offering at Rochester Regional for about 3 years now is called high-intensity focused ultrasound, or HIFU treatment, which is a new form of treatment that we're excited about. We actually just got the most recent version of the HIFU machine, Focal One, which can be used essentially for treating localized prostate cancer in the appropriately chosen patients. It's not for every patient with prostate cancer, but in the correct patient, this is a new form of therapy that we're very excited about.
So assume I don't know anything about HIFU, and I know enough to be dangerous, but describe it. What makes it unique, and are we the only ones in the area that offer HIFU?
So what's unique about HIFU, there are a couple of things. First of all, it's less invasive than some other forms of therapy. In
Okay.
other words, you're not removing the entire prostate. So one of the advantages is that it has a lower risk of incontinence than surgery.
Oh, that's important.
Right. It also, in some patients, has a lower risk of erection or erectile dysfunction, which are common
Which is reasons
side
why
effects
men
of
don't
prostate
have their
cancer
prostates
therapy.
removed, right?
Right.
Which is not necessarily good depending on the intensity or type of cancer.
Right, it depends. Yeah, it depends. I mean, there are some patients who definitely need their prostates to be removed, depending on what type of cancer they have. But for patients who seem to have an intermediate to low-risk cancer that seems to be localized to a certain area of the prostate, in other words, it's not widespread throughout the prostate, what HIFU allows us to do is treat a defined area within the prostate. And this is done based on specialized imaging with MRI, in which we can fuse the MRI images where we can actually see the lesion to be destroyed, and then the HIFU energy can be used to accomplish that.
It's fascinating to me. I learn a lot about this on the oncology side as well, talking with the oncology docs and the technology. The technology today to treat in a less invasive way is just spectacular, and we're lucky that we have clinicians that are trained and able to do it. So I want to take a break before we keep going and see if there's any questions that have come in.
Advice to newly diagnosed patients.
So I don't know if you heard Phil, but the question is, what's advice that you might give to newly diagnosed patients?
Well, the most important thing is to remember that most of the time with prostate cancer, you do have time to take a step back and really have an in-depth discussion with your urologist about what your options are for treatment. And again, that will depend on a number of factors, but essentially what your life expectancy is, what your life goals are, how you're doing already medically in terms of your urination, in terms of your sexual function, and kind of what your long-term goals are. And then how that meshes with what options are available. But the most important thing to remember is that that's an important discussion, and you have to have an individualized treatment plan. Another thing that's important to remember is I think there are three basic questions that you want to keep in mind while you're comparing and contrasting what your options are. Number one, how likely is treatment A to cure you of the cancer compared to treatment B or treatment C? And then the other two questions are major quality of life questions. What effect are each of these treatments going to have on your urinary function and your quality of life with regard to urinary function, and also with your sexual function? And if you use those three questions to bring yourself through the process of considering what your options are, generally that really helps.
That's very helpful. As I shared with you before we went on air, my father had colon cancer prostate cancer a few years ago, and I know that what helped him was having the time to think about what might be best for him, and thankfully he's landed in a good place because of the care you all provide. So I want to ask you a little bit more about the treatment options in terms of, so someone's newly diagnosed, they come in, they decide that they're going to have, say, surgery as an example. What's the recovery from that, and how long does it take for someone to sort of be back to normal?
So nowadays, the surgery for prostate removal is called a radical prostatectomy, and we do
It sounds awful.
It sounds bad, but actually the surgery itself is not that bad because we do it in a less invasive way.
Yeah.
We use a surgical robotic system to remove the prostate, which allows us to do a big surgery on the inside of your body, but through very small incisions. So typically, people do not feel a ton of pain. It's like an appropriate amount of post-surgical pain. But generally, people stay in the hospital overnight and go home the following day. Probably the most annoying part of the recovery is people have a urinary drainage catheter for about a week. Once that's removed, that's typically when the hard part actually starts of the recovery. And this is how I advise my patients. At that point, when the catheter comes out, men have to learn to regain their urinary control. And there's basically like a physical therapy process involved where you participate in your own recovery, do certain exercises and techniques that allow you to regain your control. So by 3 months after prostate removal, usually about 85% of men have good urinary control and are dry. And by a year, it's around 93%. So the risk of long-term urinary leakage with a prostatectomy is actually fairly low. And so that's part of the recovery. The other part of the recovery is recovery of your sexual function.
Yeah, I was gonna
And,
ask about
you know, men are in different places in their lives at the time they're diagnosed with prostate cancer and at the time when they're facing having a prostatectomy. Some men already have had erectile dysfunction for some time, and it may not be a major priority in their life anymore. But other men still have good erectile function, and it's extremely important to them. And for men in that situation, we also do what I call penile rehab or sexual rehab. And so men are very early on started on medications to help the nerves that provide their erectile function that can be affected by the surgery, help those nerves to heal. And then there's a host of other techniques and medications we have available. So it's very common for men to come in and tell me that they were talking to a friend of theirs and they said, oh, you have to have your prostate out, or oh, you have prostate cancer, oh, your sex life is over, buddy, you're done. And that is completely not true. There are many, many things to do to help men with their sexual function after prostate cancer treatment of all kinds, including surgery, but other types of treatment as well.
Yeah.
And using these techniques, we can almost always have anyone who's interested in having a good sex life to achieve one.
Regain that, yeah.
Yeah.
That's important because I think, I mean, in my lifetime, I've noticed the difference and the frequency with which people are willing to talk about this as a reality of treatment and then getting, having a cure and finding sort of regained lifestyle.
Right.
And I think that's important.
Absolutely.
What drove you to choose this as a profession?
Originally I thought that I was going to be a primary care doctor when I was in medical school. That was pretty much the direction I was going. But then after I did my surgery rotation,
Okay.
I realized I really, really loved doing surgery, but it was important to me to go into an area of medicine or a specialty where I had at least some patients that thought of me as their doctor, like a long-term relationship.
Yeah.
And urology is very much like that. You have some patients that kind of come and go with problems that come and go. But you also have a large number of patients that you follow long-term and form relationships with,
Yeah.
and that's, for me, the most important.
What you love about your job.
That's why I went into
Yeah.
medicine.
Yeah.
Absolutely.
It's really informative. I want to summarize and see if we got everything. So what I heard you say is, first and foremost, it's like anything else, as I do these, that I learn, it's the importance of regular screenings, because that will identify issues before they become bigger issues, right?
Right.
Regular screening through your primary care. That if you're diagnosed with prostate cancer, it doesn't mean that it's fatal. There's lots of options and lots of treatment plans.
For sure.
And that the best thing you could do is take time, get informed, get educated, have open and honest conversations with your provider to make the right choices.
You got it.
What'd I miss?
You get an A.
Thank God. What'd I miss? Anything?
No.
We talked about
honestly,
HIFU.
I don't think you missed anything.
Okay, so let's talk about Rochester Regional Health. We have offices, you have offices, your practice, I know, has offices all over, but we've got a wide breadth of services provided across our footprint.
Yes.
Right?
Yeah.
And it's integrated.
It is. And so the system as a whole has offices that span from Geneva to Batavia. We generally provide a full breadth of all urologic care. There's really nothing we don't do. And one of the things we were talking about before we went live is the fact that let's say you have a problem that requires a serious surgery and potentially some high-level care. You can have that surgery done at one of our main hospitals, but then if you live 50 miles outside of Rochester, we have offices in all of these locations, so you can be followed up at home, which makes things more convenient.
Yeah.
We-
Thank you very
Sure.
much for everything. I want to brag on Dr. Eichel for a moment. So, one of the best parts of our job in the foundation is that we often get to hear patient stories. And as you know, we did an event a few months ago where we brought yourself and a whole bunch of people together to talk about advances in robotic surgery. And I actually had patients at that event come up and ask me to take their photo with Dr. Eichel because they wanted a picture of themselves with their doctor. And so given what you said, why you went into medicine, you should know that I saw firsthand the impact that your care and your relationship has with the patients, and it was really lovely to see. So thank you for the work you do on behalf of so many of the patients that we are privileged to serve.
Well, it's our pleasure.
Yeah, well, you do it
Yeah,
well.
thank you.
Let me just check with Phil and see if we have any other questions that came in. We're all good? So Dr. Eichel, thank you very much for joining me. We appreciate your time and all the education you provided. If you have questions on anything that Dr. Eichel said, please send them in and we will get them answered for you. Thanks for being my first Facebook Live of 2020. Look forward to doing it again.
Anytime. Thank you.
Have a great day.